COVID-19 were reported. In the context of the density of the population.
Researcher Dr. Suleiman Lako makes a presentation on socio-economic disparity in Sierra Leone in the context of the COVID-19 pandemic.
34% of the population in the western area lives in informal settlements. That tells us that there is high disparity. You go to some other people, their houses are like lanterns.
He was making a case for an upcoming study designed to explore how socio-economic disparity affected responses to the health emergency in Sierra Leone and the Canadian province of Ontario. Sustainable Health Systems Sierra Leone, or SHS, a local non-profit research organization which is headed by Dr. Lako, an infectious disease expert, is collaborating with the University of Toronto in this study that will specifically look at the extent to which health equity was embedded in the public health responses of Sierra Leone and Ontario. These researchers and their partners, including the Ministry of Health, gathered at the Atlantic Hotel in Lumley on Thursday, March 7th, to set the agenda for this study.
The impact of COVID on the economy, the debt that COVID causes. But there is a critical component that we are missing, which is the aspect of equity. How equal are we when it comes to designing as well as implementing policies that are related?
SHS was established by LACOR and fellow Sierra Leonean scientists to generate evidence responsive to local needs of healthcare services users, managers, and policy makers through fostering effective collaboration and capacity strengthening for research to policy translation. The organization focuses on mental health, infectious diseases, strengthening health systems, and research capacity development. Dr. Lako, who is one of two co-chief executive officers of SHS, said this study aims to look at the past to influence the future and inform and empower policy analysts by querying whether COVID-19 policies were designed and implemented with equity lens. Lako is one of several co-principal investigators in the research. He is working alongside Dr. Stephen Sevely, who is Director of Mental Health at SHS and Commander of the Republic of Sierra Leone Armed Forces Medical Services.
This is the question: what happened and why? This is the question we are going to examine. And this question is focused on COVID-19 pandemic. And this question we intend to answer in the Sierra Leone context, as well as the Canada context. But I think for us, the texture is different, definitely, given our history of small outbreaks generally, be it cholera, be it measles, be it Lassa, but also knowing that we will experience a very big pandemic, which was Ebola. And it was against this background that we had COVID. So the texture is a bit different for us, and it is important to compare that with what is happening in other parts of the world.
Ontario is Canada's most populous province, located in the central part of the North American country and home to its capital, Ottawa. Dr. Christine Fahim and other fellow Canadian researchers at the university will work with their Sierra Leonean counterpart in this study. She explained via video link from Canada how the idea of the collaboration came about.
Research during COVID-19 in our province of Ontario, Canada, showed that broad-scale restrictive public health measures had limited impact on reducing COVID-19 cases, hospitalizations, and deaths among certain populations. This was particularly true for essential workers, those living at the economic margins, and their networks. We became increasingly interested in exploring how health equity was considered when policies for COVID-19 were shaped and were implemented.
The collaboration was made possible through funding from the Canadian government under its New Frontiers in Research Fund, announced in April 2022, which looks into post-pandemic recovery to generate guidance for future health emergencies.
So in brief, the objectives of our project is to critically assess why and how health equity was considered when COVID-19 policies were shaped in our province of Ontario and in Sierra Leone. And secondly, we want to identify the challenges, barriers, and enablers to implementing equity-rooted policies that support those most at risk during an emergency. So we believe that this project has tremendous potential for meaningful impact, and it's our intent to work closely with policymakers, community and civil organizations, and other key parties to design and conduct our study.
Deputy Chief Medical Officer Dr. Ali Wuri represented the Ministry of Health at the event, while hailing Dr. Lako and his team at SHS. Wuri spoke on the importance of research in building a resilient and responsive healthcare system.
Ministry, which is of course dedicated as a primary into guiding the nation's health, spearheaded formulation of policies grounded in equity and resilience. We've got the experience over the years. We've been faced with different challenges, moving from outbreaks, disease outbreaks, to disasters. And because of those experiences, we do recognize how necessary it is in incorporating the research in order to strengthen and in order to make our policies evidence-based.